Welcome. Welcome to hofstra's Speech-Language Pathology and Audiology webinar. My name is Jason Davidow. I'm an associate professor in the department, and I'm the graduate program director. I should also say that I do stutter as well, so you will hear that during this webinar. You can see our building for our department. It's off to the right there. The building in the lower right hand corner. It's very centrally located. We're for example right next to the library and a few places to grab lunch and dinner. So we're well located on campus. Okay, so today we're going to talk, like I mentioned, about the speech pathology and audiology program. So we have option 1 for the speech pathology program, which is a master's in speech language pathology. Option 2 is also a master's with an advanced certificate in teachers of students with speech language disabilities. So this particular certificate will allow you to work in the schools. So pretty much everybody in our program selects option 2, unless they come from a field where they might already have this advanced certificate. So we'll talk about what that involves. We also have, as you can see, under advanced certificates, as I just mentioned, that TSSLD, and bilingual extension program, which we'll talk about. We also have a consortium Doctor of Audiology, which is a professional doctorate that involves 3 schools, so Hofstra, Adelphi, and St. John's. I also forgot to mention that if you have any questions during this seminar, you can type them into the chat box, and we'll answer those when I'm done. Okay, so let's first talk about the master's in speech language pathology. It's a minimum of 52 graduate level credits. So that would be if you would have 52 credits if you do not do the TSSLD option. This is a 2-year full-time program. So you will go for a fall semester and a winter semester, and then in the spring, and then summer and fall, winter, and spring. So you're actually done in that second spring. So most people graduate in May of their second year. And the winter in your second year, you may have classes if you hadn't done all your classes during the first winter. You have 1 year one full year of in-house clinic where you'll do diagnostics, treatment, and some audiology. So your first year you have classes, and you're doing treatment in Hofstra's clinic, or we also have some clinical work in some buildings that are close to Hofstra. In your second year, you'll have your 2 to 3 externship placements. So you have to do 2, and you have an optional third one that you would do in that second summer. So your second year, you also have classes, and you're doing your externships. So if you do the TSSLD, you have one of your placements will be in an educational setting, and the other one will be a child placement or an adult placement, and you have the choice there to have your second internship in a more of a pediatric setting or in an adult setting. I'd say about 1/3 or to 1/4 of the students choose to do the optional third one. You can see the next the TSSLD option. This is 5 additional credits. So 3 of the credits come from an educational course where you discuss multilingual and multicultural issues, and the other is a course on speech-language pathology in the schools. You also have some educational law seminars that actually aren't any credits, and you have to pass. That says teacher exam, but there's actually only one now. There's this change happened recently, so and you have to pass one teacher exam that is administered outside of hofstra. And then you see the TSSLD with bilingual extension option. I would say about 4 or 5 people do the bilingual extension option each year. So if you do that, you do all the regular master's requirements, the 52 credits. You can then and the TSSLD option and the bilingual extension option, which involves 2 additional speech courses. So that's 6. Those are 6 additional credits. You take a New York State language proficiency test, which is given outside of hofstra, and your student a teaching placement would be in a bilingual community. So you don't have to take an additional student teaching placement. That would be one of your 2 required ones. You can see the deadline for fall admission is January 15th. The application is online through the CAS application system, which you can access through hofstra. You have to have a personal statement. You have to have transcripts, all your undergrad transcripts. On your transcripts, you should have a course in biology and a physical science. This is actually was just changed a month or so ago, 2 months ago. Your physical science must be a chemistry or physics course. So your physical science class must be a physics or chemistry course. Then a social science, so sociology or psychology, and a statistics course. So these are courses that the American Speech Language Hearing Association or ASHA wants you to have. So these classes can be taken during your graduate program, but most students like to have them done during their undergraduate coursework. You also have to have prerequisite speech-language pathology coursework. If you have a BA in a different field, that's less coursework. But if you go into the hofstra website, you can locate those prerequisite courses necessary. A GRE, you also have to take the GRE, and you need three letters of recommendation, and preferably from a faculty whose courses you have been in. So if you, for example, you don't want a letter of recommendation, so we see a lot of letters from maybe a clinician who you've been observing at a school or hospital. That letter is not going to be looked on as well from a faculty member. Okay, and it's good not to really have a letter from anyone who knows you personally, like for example, maybe a family member who's a speech language pathologist, or someone else who you've known for a long time. It should be somebody whose class you were in. Okay. Yeah. Okay, so now we also have, like I mentioned, we have a clinical doctorate, a clinical doctorate of clinical doctorate of audiology. So this is different than a PhD, where a PhD is more of a research program. A AUD is a clinical doctorate. This is a 4-year full-time program. So you have courses and clinical work, yeah, in the clinics at the schools for the first 3 years. You have comprehensive exams at the end of year 2 and year 3, and then in year 4, it's a strictly a clinical year. So you will do all clinical work during that 4th year. The doctorate is done at Hofstra, Adelphi, and St. John's. So you will have a home school, but you will take course. So let's say your home school is Hofstra, meaning a lot of your advisement and kind of administrative work will be done at Hofstra. You will take courses at all 3 schools. It involves 86 graduate level credits, like I mentioned, 3 years of clinic and academic work, and your 4th year you'll have placements, which will be a strictly clinical work year. And if you the online application is done through Adelphi, a university, but the procedures are similar to our speech pathology program: letters of recommendation, GREs, application essay, and they also have an interview. So for more information about the programs, you can contact me. There's my email address, which is the best way to get a hold of me, or you can also call me at my work number. All right, thank you very much, and we will answer some questions. Okay. Somebody asked if there are AP credits. AP credits on a transcript from high school. Does hofstra require a high school transcript? Check with CSD, CAS customer service, and what their requirements are in terms of transcripts, to make sure. From what I know, as long as the AP credits show up on your college transcripts, we will take them. So someone asked, "Do you accept GRE scores that are 5 years old?" And the answer is no to that one. Someone asked, "Can you talk about the bilingual extension program a little bit more?" Yeah, sure. So like I mentioned, there's 2 extra courses, and those courses are typically a smaller. There's usually about 4 or 5 people. It can be any 2 languages. Um, and, of course, one of them is English, probably. Um, but and they're usually kind of like an independent study course, where it's just a three or four people, and you're talking about yeah, bilingual, multilingual, multicultural issues. And I don't know too much about the courses themselves, since I don't teach them. But the first one is taken in the first spring semester, and the other one is taken in the first summer semester, and those will both be taken prior to your uh, um, placement, your externships. Do we send the transcripts to see it? Somebody asked, do we send the transcripts to CSDCS or Hofstra? And the answer is CSDCAS. Um, uh, what is the process like for externship placements? Yeah, so like I mentioned, you do your placements in your second year. You do one in the fall semester and one in the spring semester. Um, like I mentioned, if you do the TSSLD, you're going to do one in a school setting, but the other one you have the choice. You can do it in a pediatric setting or in an adult setting. So you can work with more with children or more with adults. Um, you do have some input into where you want to go, and the person at the clinic who's in charge of these external placements um, will try to accommodate you. Um, Somebody asked if you get rejected from Hofstra and then take online grad courses elsewhere and then reapply to Hofstra and get accepted, can those grad classes transfer in? So we can only take nine credits of graduate transfer work. Okay, so if that's your plan to hopefully eventually go to Hofstra, we can only take 9 of those transfer credits. Is there an option? Someone else asked. Is there an option on DCS to choose the option 2 for SLP Masters? No. Once you apply and we look at your application, and if you're accepted, we will do that. So don't worry about that. How many credits should we expect for the winter and summer sessions? So those the winter session, you can expect to take either 1, 2, or 3 credits, and so there's usually lighter, so to speak, but they're also shorter. The winter session is 3 weeks ish. Summer is actually divided into 3 sessions. In the first, in the first session, you will have 6 credits, and you're also continuing to do clinical work. In the second and third summer sessions, in the second, you can expect to do 2 or 3 credits. And in the third session, if you are doing anything at all, so if you haven't taken all the credits you need during the winter, you can also take some of those in the summer. So that summer session 3, you're likely to just have 1 or 2 credits. So we're just waiting for more questions, and if we don't have any in like a minute or two, we will turn off. When do you start? Somebody asked, when do you start releasing decisions? Um, it's usually around March-ish. The deadline for people to decide where they want to go is April 15th. So we try to get all our information out and decisions done by middle of March. So. Okay. One more question. So look at is part-time an option at Hofstra? It is. We might be able to work out with someone if they want to come part time. It'll take a lot of wiggling around, but we have done it. it can just be challenging since our classes are only offered once a year. Some people who have done part time, it's taken about 3.5 years to 4 years. There's one right there. Somebody asked, do we have interviews for our speech pathology program? No, but for the audiology program, yes. And those the audiology interviews are done at Adelphi. Does Hofstra offer any graduate assistantships? Yes. We have scholarships and assistantships, and once we have our incoming class, I will email out the application, and that I usually send that email around early May. Somebody said, "Do you think it's acceptable to get 2 recs from professors and a clinician that you intern observe with?" I guess you're only able to get what you can get, but I would recommend getting 3 recommendations from professors. If you have 2 from a professor and 1 from a clinician that you observe, the one from the clinician that you observe just may not be looked on as favorably. Somebody asked, "Is a thesis required for speech-language pathology students?" And the answer is no. Some graduate programs do give you the option to do a thesis or comprehensive exams. At Hofstra, we only have the comprehensive exams option. Okay. I see no more questions, so thank you for listening, and good luck with your application process. Thank you.